It was like an all of a sudden thing. I wound up with pneumonia like 9 times last year. I had 4 back surgeries. And then the next thing I know is I'm in congestive heart failure and only 35% of my heart was working.
I'm here today with my patient Amy Gibson, and we performed a procedure on her about 6 months ago that was designed to help her congestive heart failure. She has a dilated form of heart disease where her heart muscle is very weak, and we performed a procedure in order to help monitor her heart failure and optimize her fluid levels to avoid her from having symptoms of shortness of breath and other signs of congestive heart failure. The procedure that we did involved implanting a defibrillator, which is something we commonly do nowadays with patients with congestive heart failure and weak heart muscles. However, in addition to that, she received special pacing wires to help resynchronize or get her heart to beat stronger with each beat. And even in addition to that, as part of a research protocol, the laptop study protocol, we were able to implant a sensor in her heart, in the wall of her heart, that measures the pressure in her heart. That tells us exactly how much fluid she has and whether or not she's about to develop signs and symptoms of congestive heart failure. And this can help us titrate all of her medicines, including her diuretics or fluid pills, in order to optimize her heart failure. So over the last 6 months, Amy's been able to transmit to us what her fluid levels are every day, what the pressures in her heart are. And with special protocols, and my partner, Dr. Michael Craig, who's one of our congestive heart failure specialists, he's able to titrate her medicines or adjust the doses of her medicines and optimize her heart failure. So before the laptop procedure, we did not have the options of measuring direct pressures in the heart. We had to use surrogate measurements, such as physical exam measurements, checking for how much fluid is building up in the legs or the belly, or looking at the pulsations in the neck to see how high the fluid levels were. This can be very inaccurate and very difficult to do sometimes. Additionally, we could use things like having the patient weigh themselves daily. But as you know, most modern scales are not able to be as accurate, and therefore just a couple pounds of fluid can be enough to tip someone into congestive heart failure. So that can be inaccurate as well. This is the true only direct way to measure the fluid levels in the heart. Fortunately, Amy told me today, when I first met Amy, she was not able to walk basically from my office hallway to the patient room. And today she told me she was able to walk up and down the walkways of the market here in Charleston without any symptoms at all. Her congestive heart failure symptoms have been minimized by both a combination of our pacing of her heart and our ability to measure the pressures in her heart.
Choosing here was the best thing I've done because I drive 3 hours here, but it's worth it. And we literally stayed here a year last year. But with my family by my side, I wouldn't have been able to do it either, and the doctors and nurses here at MUSC. Now it's like a new life, from old to new.